Do you frequently feel like your body is tired for no reason? Or have you noticed small, painless lumps in your neck under your arms or in your groin that don't go away? These might not seem serious at first, but they could be signs of something deeper, like follicular lymphoma. It's a type of cancer that starts in the lymph nodes, which are part of your body's defense system. Imagine your immune system as an army, and the lymph nodes are like small military bases. In follicular lymphoma, the soldiers called B cells start behaving oddly, they grow too much, and don't die when they should. It usually grows slowly, so people might live with it for years without serious issues. But it still needs attention, kind of like a small fire that's quiet now, but could grow if ignored. What causes these B cells to go rogue? Well, scientists think it's due to tiny mistakes in the DNA. Think of DNA like a set of instructions for building and running your body. In follicular lymphoma, there's often a mix-up between two chromosomes, called a translocation. Specifically, chromosome 14 and 18 get confused and swap parts. This mistake tells the B cells, don't die, keep growing. That's how tumors start. But here's the thing, it's usually not inherited. So, even if your mom or dad had cancer, it doesn't mean you'll get this one. It's more like a random typo in your cell's code that builds up over time. Age matters too. Most people diagnosed are over 60. So yes, it's linked to aging, but not lifestyle choices like diet or exercise directly. Now, how would you know if something's wrong? Remember those small lumps we talked about? Those are swollen lymph nodes. They feel like peas or marbles under your skin and don't hurt. That's a clue. But your body might also send quieter signals. Have you been sweating a lot at night, so much that you need to change your pajamas? Or maybe you've lost weight without trying, like dropping 10 pounds even if you're eating normally. Or perhaps you feel weak and tired no matter how much you rest. These are called B symptoms. They're not dramatic, but together they're like your body whispering, something's off. Some people only find out after a routine blood test or scan for something else. That's why checkups matter, especially if you're over 50 and notice anything unusual. So what happens if your doctor suspects follicular lymphoma? First, they won't rely on symptoms alone. They'll want proof. The main test is a biopsy. They take a small piece of the swollen lymph node and look at it under a microscope. It's like sending a suspect to the lab for fingerprinting. They'll also do blood tests, CT scans, or PET scans to see how far it has spread, kind of like mapping the territory. Once confirmed, treatment depends on how much the disease is growing and how you feel. If it's quiet and not causing problems, doctors might just watch and wait, like monitoring a storm that hasn't hit land yet. But if it's active, treatments like targeted drugs such as rituximab, chemotherapy, or even radiation can help. Some newer treatments train your own immune cells to fight cancer. It's like upgrading your body's security system to recognize and remove the bad cells. Can you stop follicular lymphoma before it starts? That's a great question, but right now, there's no sure way to prevent it because the exact cause isn't linked to habits we can control. It's not caused by germs, smoking, or bad food. But here's what you can do: stay aware. Check your body regularly. If you feel new lumps, extreme fatigue, or unexplained weight loss, don't brush it off. Early detection isn't prevention, but it's power. Catching it early means you and your doctor can act before it becomes a bigger problem. Staying healthy overall, with good sleep, less stress, and regular checkups, keeps your immune system strong and ready for whatever comes. Here's some hope: science is moving fast. Researchers are testing new smart drugs that target only cancer cells, not healthy ones, so fewer side effects. One big advance is CAR T-cell therapy. Doctors take your own immune cells, modify them in a lab to hunt lymphoma, then put them back, like sending trained snipers to take out enemies. There are also vaccines being studied to prevent relapse. Clinical trials are ongoing, and many patients live long, full lives thanks to these breakthroughs. So while follicular lymphoma isn't curable for everyone yet, it's increasingly manageable, more like